This is the injury report presented by NYU Langone Health. Both the Yankees and the Mets have been hit with long-term injuries to a star player. So in today's injury report, we want to welcome Dr. Craig Pille, primary care sports medicine physician at NYU Langone Health, so he can break down what's going on with Giancarlo Stanton Frankie Montas. Doc, welcome. The rookie to the injury report. What's going on? Name, age, and signing bonus. That's what we used to do in the NFL.
Yeah, there you go. Well, it's very nice to be here. Thanks for having me.
All right, so let's get into the Yankees. Slugger Giancarlo Stanton hasn't swung a bat in about 3 to 4 weeks, and he's dealing with what Aaron Boone compared to as tennis elbow. So how does that happen, and what exactly is tennis elbow?
Yeah, absolutely. So, tennis elbow is also, called lateral epicondylosis. It's most often an overuse injury, impacting the common attachment site at the elbow of many muscles that help to extend and supinate or twist the palm up at the wrist. It often impacts athletes who emphasize those repetitive motions and what they do on a day-to-day basis at the elbow and the wrist. So think racket sport athletes, golf, baseball players. It's not totally common for this to be occurring in both elbows at one time, but given that Stanton's MO is swing hard, swing fast, it certainly tracks that this could be impacting him bilaterally.
Well, I'm glad you explained that, because I'm thinking like maybe he wasn't doing that much in terms of his off-season training. So do you think he could have been overtraining for this to happen?
Yeah, and especially this has been something, and to my understanding at least, that Stanton's been dealing with off and on for a really long time. And so, my guess is that, he's hitting it hard, trying to get well, getting right for the season. And, it's a fine line and, really walking that tightrope between too much activity at times.
All right, so the fact that, like you said, he's kind of suffered or had this injury before, what does the treatment for tennis elbow now involve for him, and what would a typical timeline for return to play be?
Yeah. So, typically the average person or average athlete coming in with run-of-the-mill tennis elbow, treatment starts with a dedicated rehab program, right? Focused on strengthening at the wrist and the forearm, helping to offload forces from the common tendon, that site on the upper arm bone, and disperse that force into the surrounding muscles. So, there are counterforce braces, there are elbow straps that you may have seen or heard about in terms of rehab. Oral anti-inflammatories are super important as a first step. But in folks that have more recalcitrant cases or cases that keep coming back, we can advance fairly quickly into some minimally invasive injection therapies, non-invasive shockwave therapies. The injections that do very well here are most often kind of some of those orthobiologics. So PRP or other sorts of body products that we're able to inject into this area have really good data and support for them. And usually, my hope would be on average to get an athlete back in about 6 weeks. But it gets murky when these symptoms are more chronic. And that timeline oftentimes becomes much more personalized. And any average that I can tell you kind of gets thrown out the window. It really becomes more on a person-to-person basis, how that athlete is responding to the treatments and how that athlete is progressing through the rehab protocol. And knowing Stanton's injury history, his importance in the playoff lineup, supporting Judge in that upper half of the lineup. I wouldn't be shocked to see that the Yankees play the long game in the short term with this, so that he is ready to go in those meaningful dog days of summer and into the playoff push.
So we're talking around 6 weeks for a professional athlete making millions of dollars and having access to great treatment. What would the treatment and recovery be like for just your everyday person?
Yeah, believe it or not, my goal is to have that 6 to 8 week mark be the recovery time for every one of my athletes or patients that come in. There's some things that change at the professional level, of course. With Stanton, he's getting a quicker time to diagnosis, right? He's going to get that MRI, that evaluation ASAP. He's going to have the opportunities to get some of those injection therapies much quicker, the ball rolling a little bit sooner. But for a patient in my clinic, I always tell folks I hope to see at least most improvement by about 6 to 8 weeks. It may not be perfect for every person at that point, but hopefully a steady improvement from the time that we first kind of lay hands on each other.
I can see a lot of people bragging at work like, yeah, I'm on the same recovery timeline as Giancarlo Stanton, you know. So you just made a lot of people smile with that one. Let's switch it over and head down to Port St. Lucie and talk about the Mets. Pitcher Frankie Montas is dealing with a high-grade lat strain. He's going to be shut down for about 6 to 8 weeks, and then he's going to have to go through essentially his own spring training after that. So why is the recovery so long, and how does this affect pitchers?
Yeah, for sure. So, at a bare bones, a muscle strain, what is that? Well, that's a tear within the framework of the muscle in some capacity. And traditionally, we grade those on a scale of 1 to 3, 1 being the most mild, partial tear, 3 being severe, near complete tear, and in some cases, even complete tear. And so, when we hear that Frankie has a high grade lat strain, to me, that's grade 2 or grade 3. So on the more moderate to severe end of things. And the latissimus dorsi is this muscle, this lat, is hugely important for the success and health of a pitcher, not just for generating velocity and torque about the shoulder and elbow, but it helps support the shoulder and the elbow at kind of the end stage of the throwing motion. As that elbow is cocked back and the shoulder is, most externally rotated, that latissimus dorsi is providing a lot of support and stability for that throwing motion. And, so a high grade injury to the latissimus, not only is it impactful for generating velocity, doing what, he wants to be doing on a day-to-day basis, throwing pitches, but it also could be setting him up for more risk for injury elsewhere in his arm. And so, that's why that period of really just shut down and rest is so important, avoiding anything that is triggering for his pain. And, unfortunately, as a baseball pitcher, every time he picks up a ball and throws is probably what is his most triggering event.
Boy.
So,
okay. Go ahead.
Yeah, go ahead. So that 6 to 8 week period is, typically that shutdown period. And then we need a build back period after that, right? It's kind of a workload increase, get him back into the throwing routines that he would normally be doing. And I'd anticipate that to be about, a 6-ish week return to play after feeling like we get to the point where his pain is under control.
He's also getting a platelet-rich plasma injection. We call it PRP in the pro athlete world. So can you break down why he needs the PRP injection and how is that going to help him?
Yeah, PRP is very well studied to, help support a healing process. It's your own blood product. So we're taking all the good growth factors, the good nutrients, and the, platelets within the blood that is naturally there. We're spinning it down and condensing it, and we're able to inject that into an area so that it acts almost like a beacon or a lighthouse for the body to then send more blood flow, more healthy healing and inflammation to the area to help generate a more robust healing response. And so that's probably why they opted to do this, right? To try to help expedite that process back a little bit quicker.
All right. So during his own spring training, like they're saying, after the 6 to 8 weeks that he's going to be out, how slow are they going to have to be with him in terms of ramping him back up for action? And when he does step on the mound for the first time for some real game action, is there any sort of pain management he's going to deal with, or maybe even limitations?
Yeah, that's the name of the game, right? It's going to be that tightrope between when can we get him back, what activity can he be doing that is pain-free, and ultimately how can we preserve him for as long as possible through this season, right? So, with his injury history, I think, again, they're really going to pump the brakes on getting him back as soon as possible, right? I think this is going to be more of a long haul play as well, similar to Stanton, because Montas has had a lot of shoulder issues in the past. He's undergone shoulder surgery. He's missed time for that before. And the last thing, we as sports medicine providers want to do is get him back into a situation where that shoulder is not being supported by the posterior kinetic chain or the rest of the muscles down, the rest of the chain in the throwing motion. And so this is going to be a gradual and deliberate return. It would be my best guess. And, I think this is going to be one of those situations where the Mets training staff will have all hands on deck to really make sure it's a slow and steady process with lots of, gateways and checkpoints to really get through at every step of the way to make sure that, when he's cleared to go, he's going to be feeling pretty good. And, lat strains are difficult for throwers. They can become recurrent if they're not handled with care. And all the more reason, I think, and importance to have this, be a slow and deliberate process.
All right, Doc, thanks for that, man. That was very informative. You're not a rookie anymore, baby. We got to get you back on soon.
Yeah, absolutely. Thanks so much for having me. I appreciate your time.